Welcome, and thank you for choosing Orlando Health Jewett Orthopedic Institute. I'm Mary Sanders, and I'll be guiding you through your outpatient joint replacement education. Orlando Health's mission is to improve the health and quality of life of the individuals and communities we serve. This presentation demonstrates the 6 strategic imperatives of the Orlando Health mission. Information from this presentation will help you properly prepare for your upcoming surgery. You have a great opportunity prior to surgery to prepare your home, tune up your body, and educate your brain. The purpose of this class is to help you prepare for your joint replacement surgery. It is not intended to replace information given by your surgeon. Your healthcare team may adjust some of the recommendations based on your personal needs. Be sure to contact your surgeons if you have any questions regarding your surgery. Part 1. Preparing for surgery. Prior to surgery, you should survey your home. Clear tripping hazards, such as throw rugs and electrical cords. Choose a chair, preferably one with armrests, that's comfortable and easy to get in and out of. You may stack seat cushions, firm pillows, or blankets on low-seated furniture to provide an elevated seat. Place a small table next to your chair so you can easily reach the items you may need, such as your phone or the remote control. Ask family and friends to move furniture that would prevent you from comfortably moving around with your walker. Finally, think about how you'll be entering your home. Do you have steps to climb? Is there a handrail for support? If not, you may need to install one. Use a bath mat with a rubber backing to prevent slip and fall. If you do not have grab bars or handheld shower head, consider installing them. A bath bench and commode chair are helpful when showering and using the commode. It may be helpful to prepare meals that you can freeze and easily prepare after surgery. Put often used items on an easy-to-reach shelf or surface that's at least waist high. A bed that is too high or too low will be hard to get in and out of after surgery. Bed risers made of wood or heavy-duty plastic can be used to elevate your bed. Place them under bed posts. Most of the time you can find them at home improvement stores. If you live in a 2-story house, you may want to move a bed and any essential items to the first floor. An elevated commode is recommended for anyone having a lower extremity joint replacement. If you're having a hip, knee, or ankle replacement, a walker is required. Please note that your walker should be a front-wheeled walker as shown above. A walker with 4 wheels is not allowed. Adaptive equipment such as sock aids, reachers, grabbers, and leg lifters can be helpful and provide independence during your recovery. These items are not normally covered by your insurance, but they can be purchased at your local medical supply store or online at places like Amazon.com. You will need to have someone stay with you 24 hours a day for the first 3 to 7 days after surgery. Depending on your surgeon, you will either have home health services or attend outpatient PT. Therefore, you will need a friend or family member to drive you to these appointments. There are multiple tests, such as an EKG, lab work, MRSA, nasal swab screening test, and either a cardiac or medical clearance needed for your surgery. These will be ordered by your medical provider or surgeon. You will need to stop blood thinning medications and supplements as directed by your surgeon's office. Typically, this is 7 to 14 days before surgery. Be sure to bring your ID and insurance card to all appointments. Our skin is the first line of defense against infection. It naturally has germs or bacteria on it. To cut down on the chance of infection, you will be using chlorhexidine soap several days prior to surgery. You will receive specific instructions on how and when to use this soap. It can be purchased at your local pharmacy and found where first aid supplies are found. You will also find it online at Amazon. You will need 2 8-ounce bottles. Diet and nutrition is very important to the healing process. Be sure to get adequate amounts of protein for wound healing. The food pyramid is included here to help you with your food choices. Keep in mind to eat healthy and avoid food high in sodium. Eating fruits and vegetables daily will help prevent constipation caused by anesthesia and pain medications. It is important to stay well hydrated prior to surgery. Water is essential for our bodies because it has many functions. It helps thin the blood and move nutrients. It transports waste from cells and removes toxins. It helps eliminate anesthesia and helps prevent constipation. The day before surgery, please limit your caffeine intake and refrain from alcohol for 48 hours prior to surgery. Smoking interferes with blood circulation by constricting blood vessels that carry oxygen and nutrients throughout the body. When these vessels are constricted, it prevents optimal blood flow to the affected area, slowing down the healing process and increasing your chance of infection. You must stop smoking at least 4 weeks prior to surgery. Committing to an exercise program before surgery has many benefits. Studies show that patients who participate in regular exercise prior to surgery have more successful outcomes than those who didn't. Take this opportunity before surgery to form a good exercise habit and improve your strength, range of motion, and overall health. Part 2, what to expect and bring the day of surgery. On the day of surgery, please remember to take your last chlorhexidine shower. If applicable, you may take approved medications with a small sip of water. The surgery center has a pharmacy that can provide any new postoperative medications ordered by your surgeon. They can be delivered to you in the recovery room after surgery. Your caregiver can be with you in pre-op and later in the recovery room. Please remember to bring your walker and 3 pairs of Depends undergarments with you when you report to the preoperative area. When you arrive to the preoperative area, you will empty your bladder and wash your hands. You will be given an iodine nasal prep and skin cleansing cloths. The iodine swabs help kill microbes and provide up to 24 hours of protection. You will be given 6 cleansing cloths to wipe down with prior to applying your gown. It should take no more than 5 minutes to wipe down prior to putting on your gown. You will be given instructions from your nurse on when to put your Depends undergarments on. You will meet your anesthesiologist in the pre-op area prior to surgery to discuss your anesthesia options. Patients having hip replacements typically receive 2 types of anesthesia, a spinal block and general anesthesia. Patients having shoulder replacements typically receive general anesthesia, but are also supported by a peripheral nerve block. Patients having knee replacements typically receive 3 types of anesthesia, a peripheral nerve block, a spinal block, and general anesthesia. When surgery is complete, your surgeon will contact your caregiver to let them know how the procedure went. You will be transferred to the recovery room. The recovery room nurse will contact your caregiver and invite them back to the recovery room bay to accompany you until it's time for discharge. During your stay, you will be asked to rate your pain on a 0 to 10 scale. 0 represents no pain, and 10 represents the worst possible pain. It's not realistic to be at a 0. Pain medication will be given as needed to be in only tolerable discomfort by discharge. A variety of techniques will be used to help manage your pain after surgery. A very effective technique is called a peripheral nerve block. It is a procedure performed by the anesthesiologist just prior to surgery. An injection of numbing medication is administered near the nerves that affect the joint you're having surgery on. A routine nerve block can last 12 to 24 hours. The anesthesiologist may include a medication to the injection called Exparel. A nerve block with Exparel may last up to 72 hours. If you've been given Exparel, you will be given a teal wristband as shown above. It will need to be worn around your wrist for the first 96 hours after surgery. Its purpose is to alert other healthcare providers not to give similar medications causing toxicity. The bracelet includes the drug's name and lists the date and time you're allowed to remove it. Your surgeon will close the surgical site with either stitches, sutures, staples, or skin glue. Your incision will then be covered by an Aquacel dressing. The Aquacel dressing is waterproof and meant to be left in place for 7 days postoperatively. After your surgery, you may have one or more of these devices on your legs. VenaFlow devices are inflatable sleeves which have been applied to your legs to help prevent blood clots. An abduction pillow may be used for hip replacements to prevent dislocation of the hip immediately after surgery. A knee immobilizer may be used for patients who require additional knee support after surgery. The surgeon may utilize meds to bed program through Select Pharmacy when ordering your postoperative medications. If so, these medications can be delivered to the bedside prior to discharge. What you need to know after surgery. Patients having a lower extremity joint replacement will have physical therapy evaluation and treatment sessions while in the recovery room. Typically, this begins an hour after entering the recovery room. The therapist will begin the rehabilitation process with mobility training with your rolling walker. You and your caregiver will also be instructed on your home exercise routine and about any specific rules commonly known as joint precautions. It is important to prevent pneumonia after surgery. You will be given an incentive spirometer and instructions in its use. The goal to achieve is a slow, sustained breath in. This should be done 10 to 15 times per hour while awake for the first several days after surgery. There are several ways to prevent blood clots. Your surgeon will prescribe a blood thinner to begin after surgery. The nurse will apply compressive socks called TED hose and a VenaFlow device to your lower legs. The best and most effective way to prevent blood clots after surgery is to simply walk. During the day, try to get up and walk each hour. Early and routine ambulation after surgery helps prevent post-surgical complications such as blood clots and constipation. Ankle pumps are a good exercise to help move the blood in the calf, which aids in blood clot prevention. Anesthesia, narcotics, decreased fluid intake, and lack of activity are leading causes of constipation. Eating properly with plenty of fruits and vegetables and drinking fluids will help prevent constipation. Other suggestions include stool softeners and laxatives such as Colace, Miralax, and Milka Magnesia. We suggest starting one of these the day after surgery. Hand washing is the best way to help prevent infection. The best way to wash your hands is to wet them with water and apply soap. Lather and scrub for at least 20 seconds before rinsing. Be sure to change and clean bed linens often. Your surgeon asks that you do not schedule dental cleanings within a month of your upcoming surgery, and not again for 6 months after surgery. Dental emergencies like an abscess or broken tooth must be handled as soon as possible. Either your surgeon or the dentist will prescribe an antibiotic prior to all dental procedures for 2 years following your joint replacement. Contact your surgeon should you experience excessive leg swelling or pain, a temperature of 101 or higher, pale or dusky appearance to the leg or foot.
Hello, my name is Dan DeAndrea, and I'm a physical therapist here at Orlando Health. Hang in there are just a few more slides to go as we finish your preoperative education class. Here are some final tips on precautions after hip and knee replacement surgery. Following knee replacement, attaining knee extension is one of the most important goals. As shown in the top right picture, the position to help promote full knee extension is when a small towel roll is placed under the ankle of the operated side. As a precaution, do not rest with a pillow or other support behind your bent knee, as it'll allow the knee to stiffen in the bent position. It's common for your lower leg to become swollen. To reduce the swelling in your lower leg and foot, elevate it for about 30 minutes 2 to 3 times a day using multiple pillows or a wedge pillow that maintains a straight knee. After hip replacement surgery, patients have precautions or positions to avoid. Precautions will generally last for 6 weeks, but check with your surgeon for specific instructions. If your hip replacement is performed with a lateral or a posterior approach, there are generally 3 restricted positions to avoid. Number one is do not flex your hip greater than 90 degrees as in bending forward. Therefore, avoid sitting on very low seats. Number two, do not cross your legs. Keep a small space between your knees, especially when transferring from sit to stand or when laying down. Number three, do not rotate your operated hip inward excessively. This means avoid the pigeon-toed position while walking or while turning around. Patients having hip replacement with an anterior approach will generally have two precautions to follow. Number one is no excessive hip extension, as seen on the picture on the left, as this position will place pressure on the anterior hip incision. Number two, no excessive external rotation on the operated leg. This position is commonly known as the duck walking position or the duck foot position. So that when you do want to turn around in the standing position, pick up your feet to avoid pivoting on the operated leg. And finally, a note about your rolling walker. Please bring your front-wheeled rolling walker to the surgery center to use after your surgery. Your physical therapist will make sure it is adjusted properly. The height of the walker should be at the crease of your wrist when your arms are resting at your sides in standing position. Please note that the walker with 4 wheels and a seat, commonly referred to as a rollator, is not recommended. And that brings us to the end of our presentation. On behalf of Orlando Health and the Jewett Orthopedic Institute, thanks for being an active listener. We look forward to working with you in the near future. If you have any questions, please feel free to contact our pre-admission department or contact your surgeon for more information. See you soon.